Welcome to Emergency Office Hours. My name is Danny, and today I wanted to talk about compartment syndrome. Before I get into it, don't forget to check out the official website, TikTok, and Instagram accounts for more learning resources. Let's get started. If you examine a cross-section of a muscle, you can note the following: various muscle compartments, each surrounded by a thin layer of fascia, and vasculature containing both veins and arteries. When there is any pressure increase from within the muscle compartment, the body encounters an issue. Because the fascia that surrounds each muscle compartment is tight and inelastic, it cannot accommodate much increase in muscle compartment pressure. Because the compartment cannot expand outward, it uses as much inward space as it can, taking away from the space that the vasculature utilizes. Eventually, the compartment pressure will exceed arterial flow pressure, causing a disruption. Anytime a disruption in arterial flow happens, any tissues distal to the disruption are no longer perfused. And this is why compartment syndrome is a medical emergency. It can lead to tissue ischemia, necrosis, sepsis, and death. The next question to answer is, what causes the increase in muscle compartment pressure? The increase is most often from trauma, like fractures, crush injuries, burns, snake bites, and improperly placed casts and splints. But compartment syndrome can also happen from things like intense exercise or secondary to a bleeding disorder. Although there are a handful of causes, the most common cause is a long bone fracture, with tibial fractures contributing to most cases. Areas of compartment syndrome are usually in the limbs, but they can also happen in the hands, abdomen, buttocks, and feet. When a patient has compartment syndrome, the earliest sign is a pressure in the area. They'll often say something like, "My leg feels like wood." Late signs can be recalled as the 5 Ps: pain, pallor, pulseless, paresthesia, and paralysis. If you have a patient with recent trauma or soft tissue injury and complaints of any of the 5 Ps to that area, you should be suspicious of compartment syndrome. Once the provider makes this diagnosis, the first step is removing any restrictive items around the area, such as casts, splints, or bandages, and this is to help relieve some of that pressure externally. The provider will consult surgery and order supportive treatments like pain medications. If the surgery team gives the okay that the compartment syndrome was detected early enough, a fasciotomy can be performed. And this is a procedure that surgically opens the fascia surrounding the affected compartment to relieve that pressure and decrease the compression of arterial blood flow. Other things to evaluate for with your compartment syndrome patients are signs of infection or tissue necrosis secondary to that interrupted arterial flow, as well as hyperkalemia, rhabdomyolysis, and renal injury secondary to muscle breakdown. Thanks for watching. Don't forget to check out the official Emergency Office Hours website and social media accounts. And if you found this video on compartment syndrome helpful, tune in again next time for more Emergency Office Hours.